Welcome to this explainer. Okay, I want you to imagine, just for a second, that your body's cardiovascular system is this massive, sprawling, super efficient highway network. Blood cells are the cars, right? Delivering vital nutrients and oxygen to every single city and town in your body. And honestly, most of the time, traffic flows beautifully. But what happens when there's a hidden traffic jam? A roadblock that you might not even realize is building up until it completely halts the commute. Well, today, we're shining a big spotlight on exactly that scenario. It's a condition known as peripheral vascular disease, or PVD for short. We're going to look closely at the source material to figure out exactly how these internal roadblocks form, the clues your body gives you when traffic starts slowing down, and most importantly, how we can clear the roads.
Okay, let's dive into this. Here is our roadmap for today's explainer. 1. Understanding PVD. 2. The root causes. 3. Spotting the warning signs. 4. Diagnosing the problem. And finally, number 5, taking back control.
So, Section 1. Understanding peripheral vascular disease, the roadblock in your body's highway system.
All right, so what exactly is it? Peripheral vascular disease, or PVD, is a medical condition where the blood vessels outside your heart and brain become narrowed or blocked. The absolute key word here is peripheral. You know, we hear all the time about blocked arteries in the heart causing a heart attack or in the brain causing a stroke. But PVD? It specifically targets those peripheral roads, the arteries and veins that are way further out from the city center, primarily the ones supplying your limbs. When these vessels narrow, the lanes of our internal highway physically shrink, which severely reduces the amount of traffic that can actually get through.
And what this brilliantly illustrates is the main consequence of that narrowing: reduced blood flow to the limbs. Now, while PVD can absolutely happen in your arms, the most common victims by far are your legs. I mean, think about it. Your legs are incredibly far away from your heart, and they require a massive amount of blood and oxygen, especially when you're moving around. So when the highway to your legs gets restricted, the muscles and tissues down there quite literally begin to starve for oxygen.
Moving on to Section 2, the root causes, identifying the bad drivers on the road.
The primary villain causing this roadblock is something called atherosclerosis. This is basically the buildup of fatty deposits and plaque right inside the artery walls. Imagine someone just dumping debris and concrete onto the shoulders of a highway, and it's slowly creeping into the driving lanes day by day, year by year. That plaque hardens, it narrows the arteries, and suddenly it turns a wide-open 4-lane road into a sluggish, bumpy 1-lane street.
But you know, atherosclerosis usually doesn't happen in a vacuum. Based on the medical literature, we've got a whole lineup of other major culprits that contribute to this traffic jam. We have diabetes, which can actually damage the inner lining of the blood vessels. We have smoking, a massive risk factor, which constricts the blood vessels while simultaneously damaging their walls. High blood pressure acts kind of like vehicles speeding way too fast and tearing up the road surface over time. Meanwhile, high cholesterol is the literal raw material making up that sticky plaque. The sources also point to inflammation of the blood vessels, which is known as vasculitis, and blood clots, which can suddenly act as a totally impassable barrier on the road. And unfortunately, these factors often work together, really compounding the damage.
Let's head into Section 3, spotting the warning signs, listening to the sirens of your internal highway. Now, this is a truly critical point from the sources. PVD can be completely asymptomatic in its early stages. That makes it a really hidden threat. You could have significant plaque buildup, your internal highways could be narrowing as we speak, and you might feel absolutely nothing. Zero warning signs. Your body is incredibly resilient, right? It'll try to compensate. But eventually, the supply of oxygen simply cannot meet the demand. Now, what's really interesting here is the defining symptom that eventually does show up. It's a medical term called claudication. This is basically leg pain triggered by walking. But, and here's the kicker, it completely resolves and improves with rest. It's a classic supply and demand mismatch. When you're just sitting down and resting, your leg muscles don't need much oxygen, so that narrow, blocked artery can supply enough blood just fine. But the moment you start walking, the demand spikes. The narrowed highways simply cannot deliver enough blood cells fast enough. So the muscles cramp, they ache, they literally scream for oxygen, causing pain. Then, when you stop and rest, the demand drops back down, the oxygen catches up, and the pain mysteriously vanishes. But claudication isn't the only clue. The sources actually list several other physical signs that your legs are being starved of blood. You might experience numbness, weakness, or just this weird feeling of heaviness in your legs. You might notice a distinct coldness in your lower leg or foot compared to the rest of your body.
And because there isn't enough nutrient-rich blood reaching the skin, you might see sores or wounds on your toes, feet, or legs that simply refuse to heal. You could even experience hair loss, or notice that the skin on your legs looks unusually shiny. And logically, if a doctor checks the pulse in your feet, they'll find it to be very weak or sometimes completely absent. I really urge you, don't brush these symptoms off as just getting older. These are direct distress signals from your peripheral roads.
Which brings us to Section 4, diagnosing the problem, shining a light on the hidden blockage.
Let's move along and see how doctors actually build a complete diagnostic picture here. We have 4 main tools. First up is the Ankle Brachial Index, or ABI. It's brilliantly simple, actually. Doctors compare the blood pressure in your ankle to the blood pressure in your arm. Normally, they should be pretty close. But if the pressure in your ankle is significantly lower, well, that proves there's a blockage somewhere along the route restricting the flow. Next is the Doppler ultrasound. This uses sound waves to assess the real-time speed and flow of the blood in the arteries. If they need a direct visual, they'll use angiography, which could be a CT scan, an MRI, or a catheter procedure, to literally map out the blood vessels and see exactly where that narrowing is. Finally, standard blood tests are used to check for those underlying culprits we talked about earlier: diabetes, high cholesterol, and clotting issues.
All right, Section 5, taking back control, clearing the traffic and restoring flow.
So treatment generally falls into a two-pronged approach. On one side, we have lifestyle changes. This is the everyday work, the personal action you can take to improve your highway infrastructure. On the flip side, we have medications. This is the pharmaceutical help available to alter the chemical makeup of the traffic and the roads themselves. To successfully clear the roadblock, you almost always need to tackle both sides. Let's look at the lifestyle interventions first. Number 1, without question, is to quit smoking. Smoking is actively destroying your blood vessels. Stopping is literally the fastest way to halt further damage. Next is regular exercise. And interestingly, the sources specifically highlight that supervised walking programs are incredibly beneficial. I know it sounds counterintuitive since walking causes that pain, but consistently pushing through in a supervised, structured walking program actually forces your body to build new, tiny blood vessels around the blockages. It quite literally builds detour routes to bypass the traffic jam. How cool is that? Finally, maintaining a healthy diet and focusing on weight loss directly reduces the strain on your entire cardiovascular system and helps stop new plaque from forming.
On the medical intervention side, doctors have some really powerful tools to help out. They might prescribe antiplatelet medications, like aspirin or clopidogrel. These basically make your blood cells less sticky, which prevents them from clumping together and causing a sudden, complete blockage. There are also cholesterol-lowering drugs, specifically statins, to stop the plaque buildup. The crucial point here is that a massive part of treating PVD is actually about aggressively managing those underlying causes, getting your blood pressure down and keeping your diabetes strictly controlled. And hey, for the immediate comfort of the patient, there are also specific medications designed to improve blood flow and directly reduce that walking-induced leg pain.
So, we've covered the hidden traffic jam, the culprits causing the roadblocks, the subtle alarms your body rings, and the structured ways to clear the streets. Which leaves us with one final, incredibly important thought to end on. Are you listening to what your legs are telling you? Because as we've learned from the sources today, paying attention to a simple cramp or persistent coldness in your foot might just be the key to keeping your body's vital highways wide open for years to come. Thank you so much for joining me for this explainer, and keep learning.